Ulnar nerve injuries and conditions. The ulnar nerve is one of the 5 terminal branches of the brachial plexus and arises from the medial cord. It runs down the medial side of the arm, forearm, and into the wrist, hand, and fingers. The ulnar nerve provides motor innervation to many of the muscles along its course, including the flexor digitorum profundus, flexor carpi ulnaris, adductor pollicis, the deep head of the flexor pollicis brevis, dorsal and palmar interossei, and the 3rd and 4th lumbricals. The ulnar nerve also provides motor innervation to the adductor digiti minimi, opponens digiti minimi, and flexor digiti minimi. There are 3 branches that provide sensory innervation to the medial forearm, medial wrist, and medial digits, called the dorsal cutaneous, palmar cutaneous, and superficial terminal branches. The ulnar nerve runs from the medial cord of the brachial plexus down the medial side of the arm into the medial intramuscular septum at the arcade of Struthers, which is a common site of ulnar nerve compression or entrapment. From there it passes posteriorly between the olecranon process and medial epicondyle at the elbow. This region is called the cubital tunnel, and it is made up of the medial epicondyle, the olecranon process, the elbow joint capsule, and the cubital tunnel retinaculum or ligament of Osborn. From this region, it enters the forearm between the 2 heads of the flexor carpi ulnaris. This is another common site of compression or entrapment. The ulnar nerve then travels under the flexor carpi ulnaris and medially above the flexor digitorum profundus. The ulnar nerve enters the wrist passing superficially to the flexor retinaculum and into the palm through Guyon's canal. From here, the nerve branches to innervate the muscles of the hand. Pathology. A structural abnormality can cause the nerve to become compressed, displaced, or under traction. Injuries and conditions. Cubital tunnel syndrome is compression of the ulnar nerve at the elbow region. Guyon's canal syndrome is similar to cubital tunnel syndrome, but occurs as the ulnar nerve passes through the wrist. Ulnar nerve palsy is a general term referring to loss of sensation and function relating to damage of the ulnar nerve. Ulnar nerve entrapment occurs when the nerve is compressed. This condition is common in cyclists and is referred to as bicycler's neuropathy or handlebar palsy because of the position and pressure exerted on the hand and wrist when biking for extended periods of time. The wrist is often hyperextended and resting on the handlebars, causing the nerve to stretch and become compressed. Mechanisms of injury for these conditions can be direct trauma, nerve impingement, lacerations causing nerve damage, fractures, dislocations, edema, and prolonged or excessive stretching. The signs and symptoms associated with these conditions are numbness and tingling, burning, pins and needles, weakness, pain or tenderness, and sensitivity to sensation like hot and cold. Special tests include the Frohman sign, in which the patient holds something with their thumb and fingers while the clinician attempts to pull it out of their hands, the nerve conduction test, and Tinel sign. More special tests for ulnar nerve are the elbow flexion test, flexion compression test, pressure provocation test, and scratch collapse test. Predisposing factors include sports participation, alcohol or drug abuse, sleeping position, some diseases like arthritis and diabetes, repetitive or prolonged activity, and prior fracture or dislocation. The police principle, activity modification, physical therapy, bracing, padding, and splinting, and surgery may all be suggested to manage and treat this condition. Tommy John surgery is reconstruction of the ulnar collateral ligament that involves using another tendon to attach to the ulnar humerus to act as a new UCL. It is common that the ulnar nerve is moved to a different position during these procedures to prevent future complications. If this condition can't be managed by an athletic trainer or there is no improvement, then the athlete should be referred to a physician. To prevent this condition, athletes should limit repetitive motions or activities, wear a splint, and prevent resting the arm on surfaces for extended periods of time and prevent falls or direct impacts. Mulligan cannot be performed for nerve injuries.